I'm a member of the Division of Surgery and Interventional Science, and I work at the Institute of Orthopaedics, which is based at the Royal National Orthopaedic Hospital in Istanbul, just about 9 miles from here. And at this hospital, we are a centre for treating bone cancers. Now, fortunately, bone tumours are relatively rare, but they do occur in a young group, a young population of people. They are treated with chemotherapy and in some cases with radiotherapy, followed by surgery to remove the tumour and the replacement of the removed bone with a massive orthopaedic implant. So here we see a proximal femoral replacement, which is fixed to the remaining distal fragment of the femur, and a hip joint replacement. And this is a distal femoral replacement fixed to the proximal part of the femur using an intramedullary stem, a hinged knee joint replacement and a tibial component, and this implant has been inserted into a young child at the age of 6. Now, these patients are achieving a good survivorship due to the treatment with chemotherapy. But the important fact is that in the mid-1990s, the survival rate of these implants in these patients was limited. So at 10 years, the distal femoral replacements, the survival rate was only about 60 to 70%. So you can imagine that if you had a young patient, then this patient would be faced with multiple revision procedures, multiple operations, which obviously isn't good. And we set about trying to improve the fixation of these prostheses. The problem is the way these implants are fixed to the bone, they become loose and then have to be removed. So one of the things that we did eventually was to use a hydroxyapatite coated grooved collar on the implant adjacent to the transection site. And hydroxyapatite is the inorganic component of bone, and you can produce this and you can actually coat a prosthesis. And you can see how this enhances bone formation and leads to bone bridging from the femoral shaft over onto the shaft of the prosthesis. And this improves load transfer and improves fixation. And this is just a histological picture. It shows a single groove with the hydroxyapatite coating and bone integrated with that HA coating. However, this does not work in every case, and we wanted to further improve the fixation using tissue engineering techniques, using mesenchymal stem cells. And I'm going to show some work associated with the development of this technique. So, stem cells are easily obtained. We get them from the iliac crest of animals and of patients, and they can be sorted and they can be characterized by flow cytometry. You can actually differentiate these stem cells in tissue culture by giving them various supplements. And the osteogenic supplements that we use to turn these cells into osteoblast bone cells are actually dexamethasone and beta-glycerol phosphate. And what happens is that these cells produce proteins associated with mineralization, such as alkaline phosphatase, and after about 21 days in culture, they produce bone mineral, which has the characteristic calcium phosphate ratio associated with hydroxyapatite. So we know that chemotherapy significantly improves the survival rates of these kids. However, chemotherapy is also known to inhibit bone formation and bone turnover. So in the first experiment that I'm going to talk about, our aim was to investigate whether mesenchymal stem cells within fibrin glue would increase bone regeneration within femoral defects. And some of the rats that we treated had chemotherapy. These cells, the mesenchymal stem cells, were incorporated into the thrombin component of fibrin glue, which was then mixed with fibrinogen, which then set into a fibrin clot with incorporated cells. So we asked the question whether these cells survive within the fibrin glue, and we looked at a metabolic assay called Alamar glue, and we looked at thymidine incorporation to look at the turnover of DNA, and you can see that there's about an 80% level of metabolic activity compared to control cells, and these cells, the control cells, were cells grown in a monolayer, the same number of cells as those incorporated into the glue. And you can see that for thymidine incorporation into DNA, there is a level which stays up to 96 hours, and that tells us that these cells are dividing and are viable. So here we see dividing cells within the fibrin glue, and in TEM, these cells appear to be relatively healthy. So in this first experiment, we used a rat bone defect model with a 3 millimeter gap in the midpoint of the femoral shaft. We used 36 rats, half of which received chemotherapy. This chemotherapy regime was somewhat similar to the chemotherapy regime used in humans, in as much as we gave cisplatin and doxorubicin at the same levels relative to a human being, and we gave 3 injections intraperitoneally. There were 3 experimental groups. We had an osteotomy without anything in, we had an osteotomy with fibrin glue, and an osteotomy with fibrin glue with 100,000 stem cells. And this osteotomy was stabilised by an external fixator. And this is the data for the 5-week time period. And these 3 bars demonstrate animals, bone regeneration within the gap in animals that weren't given chemotherapy. And these 3 bars are for animals that have been given chemotherapy. You can see that chemotherapy in the control group compresses bone formation. You can also see that when you give mesenchymal stem cells in the control group in fibrin glue, you increase bone formation. But importantly, when you give mesenchymal stem cells in the chemotherapy group, bone formation is at a similar level.